Do you or someone you know or love been diagnosed with Alzheimer's or dementia? If you have, this is just as all the information is all for you. So please listen and please stay tuned so you can learn. As you know, most of you know, I'm a dental hygienist. I've got 30 years of experience treating patients, and I've seen a little bit of everything over those years. What I have learned over the years is how much inflammation in your body from your mouth can affect those systemic diseases. This is where the Alzheimer's and dementia complicated by the mouth bacteria. So bacteria that enter your mouth, most of them cause you harm. There are good bacteria in your mouth. We always talk about the bad things, of course. But the bad bacteria that are in your mouth, if not removed daily, can live under the gums. Once they're under the gums, then they have access, they've gained access to your bloodstream. What does that mean for you? If there's any inflammation in your mouth that's not being removed, it's now in your bloodstream. So it's going to your brain, your heart, your kidneys, liver, pancreas, everything. Lungs. So we want to make sure that if you have Alzheimer's or dementia, that you understand the association of the mouth with the brain. So the bacteria, some of those bacteria that live in your mouth, once they get to the brain, they're able to break the blood-brain barrier. What does that mean for Alzheimer's or dementia? There's a correlation of the bacteria entered into the brain. The inflammation makes Alzheimer's and dementia, those conditions, worse. This is important because we want to make sure that we're doing everything we can to keep you or your loved one as healthy and as in normal state as possible. So the first thing that I would recommend doing is seeing your dentist if you have not seen a dentist in the last 3 to 6 months. Have a good checkup done. I would also be mindful of brushing. As you know, patients who have dementia or Alzheimer's in the middle or late stages are not really interested in brushing or keeping their mouth clean. This is where it becomes very, very important and helpful for them. So we want to make sure that we make it easy for them to help themselves or for you to help them. One thing that I would recommend is having a dry toothbrush sitting by their chair so that they can brush their teeth after they eat. You don't have to have toothpaste on your toothbrush to brush your teeth. Dry brushing is something that they used to tell the Marines that were in the field because they didn't have a sink, lights, running water to brush your teeth. So dry toothbrushing is really effective. If the patient is able to floss their teeth, of course we want them to floss. Water picking is another option that can be done as well. They can't do that sitting while they're watching TV. Some options that they can do if they're sitting watching TV is to use a little floss on the stick. I don't have any with me, but floss on the stick. And also getting them a rubber tip stimulator. You can buy these at Dollar General, Walmart, the drugstore. And what you do is you just put it along the gum line and you move it around where the gum line is. This disturbs food debris. This disturbs bacteria before it gets under the gums. And it also helps to condition the gums and toughen them up, which is very helpful. The other things that I would recommend doing is getting a little interdental brush. Those little green tip brushes, they can stick right through there. You want to make sure that they're getting a good diet. Diet, especially later in life, is so very valuable for the nutrients that your mouth needs to keep the teeth and gums and cheeks strong. Drink plenty of water. This is another hard one to do, is drink plenty of water. Make sure you see your doctor regularly. If the medications that they're taking causes their mouth to be dry, then they're going to have more complications with that. Be mindful of regular commercial toothpaste. Much of them have sodium lauryl sulfate in them. This is an active ingredient, or this is an ingredient that they put in to make it suds up and clean. But the side effect is that it takes the natural oils from your tissues, so your skin or your cheek tissues, your mouth. So be careful about the loaded sodium lauryl sulfate if they have a dry mouth. This is going to cause more cavities and more gum infection. And you want to make sure that their mouth stays moistened, because a moistened mouth is able to really fight any bacteria, food debris, cavities, gum disease. One more thing that I'd like to recommend to you is xylitol. Get a xylitol product for them to use. Xylitol is a naturally occurring sugar alcohol. It is not an artificial sweetener. They make toothpaste, they make mints, they make chewing gum, they make mouth rinse, they make mouth spray to moisten your mouth with xylitol. You want to make sure you get a pure xylitol product. My favorite that I use at home is Spry, S-P-R-Y. Love it. It works really well. And the thought behind the xylitol is, the science behind it is, xylitol is a 5-carbon sugar. So when the bacteria eat it, they die. So less cavities, less gum disease is what you'll get when you have xylitol. And it's easy to pop a couple mints in the mouth. You can't always brush, you can't always water pick, but you can use a couple mints or a piece of chewing gum or a little mouth spray. So hopefully these things will help you. These little tips and tricks will help you, and I hope this helps you to understand how important the mouth is to the brain health. God bless you if you take care of a patient that has Alzheimer's or dementia, or if you have it, hang in there. Stay as healthy as you can. I hope these tips and tricks help you. Come back for more. Subscribe and like. I'd love to be able to educate you more. I'm thinking of stuff all the time. If there's something you want to learn about with your mouth, then I would love to know what you think. So send questions down below or send me a message. Becky will restart Hygiene. Hope you have a great day. Thanks.